Hello, this is Jordan Sedlacek, Assistant Professor at Larkin University College of Pharmacy. I'm here with Dr. Joshua Caballero, Department Chair at Larkin University College of Pharmacy, and also editor and co-author of the book, Get the Residency. Welcome, Dr. Caballero.
Oh, thank you very much for having me, Dr. Sedlacek.
Today we're going to be discussing ASHP's 75th anniversary, in particular residencies, since you are one of the experts on residencies. Back in 1963, ASHP had 32 accredited residencies. Now we have about 4,600 accredited residencies. What do you think about that increase?
I think that increase, when you really take a look at the 50 plus years, it really only averages out to about 80, 85 residencies per year. However, what should be noted is that in the last 3-4 years, there's been an increase of about 1,500 residencies. And that really just speaks volumes of those pharmacy directors and residency coordinators that are out there trying to promote and justify the increase in these residencies.
So speaking of justifying the residencies, how do you think that potential pharmacy residency program directors can justify those new positions?
Yeah, that's a great question. And as we're gaining more and more provider status and finding novel ways to bill for services, we are primed to start gathering data on objective measures that we can then use to justify additional services and thereby increasing the number of residencies.
Perfect, that sounds great. Switching gears a little bit, going into specialty residencies, in 1979, the first residency that was accredited was a psychology residency. And I know you're a neuropsych pharmacist, so how has that neuropsych specialty residency impacted your career?
Being a psychiatric pharmacist has been one of the best decisions I ever made in my life. I had wonderful mentors, and what's really been great about the field is that by the time that I'm getting a patient case to review and I'm being asked to review patient records, we're already kind of out of the guidelines. So as myself and others, we have to find creative ways and think outside the box of how to best take care of our patients. And it's also been a great field because I've been able to transcend into different specialties using my psychiatric knowledge. So I've been able to work in infectious disease with HIV, I've been able to work in an AM care setting, I've been able to work inpatient, so it's been a great and rewarding experience.
So speaking of different specialties, where do you see the specialties growing from here?
One of the areas that I see growing is perhaps within ambulatory care. I see endocrine becoming a larger monster per se, and I can even see that becoming its own specialty at some point.
All right, well, thank you very much, Dr. Caballero. This has been ASHP TV. Thank you.
All right, thank you very much, guys.